Welcome to Vancouver Overcast, where we talk with leaders and influencers in many areas of the public and private sectors. I'm your host, Mike Klassen. On this episode of the podcast, I'm joined by someone who's worn a lot of hats: veterinarian, mayor, cabinet minister, cannabis industry executive, and most recently, a leading voice in the seniors care sector. Terry Lake has had an incredible career in public service, first as the mayor of Kamloops, then as an MLA, and later as BC's Minister of Health, where he tackled some of the province's biggest healthcare challenges, including the opioid crisis. After stepping away from politics, he took on the role of CEO at BC Care Providers Association, right in the middle of the COVID-19 pandemic, advocating for better seniors care in BC. But beyond his professional life, Terry is also an animal lover, a family man, and full disclosure, my former boss when I worked at BCCPA before entering politics myself. Terry has announced that he is retiring as CEO at BCCPA, and with this upcoming retirement, I wanted to sit down with him to reflect on his journey, the lessons he's learned, and where he thinks we need to go as a province to tackle our biggest challenges. Terry, welcome to Vancouver Overcast.
Well, thanks, Mike. Sure great to see you. And, I've been following your political career, and just want to thank you for your public service, and especially for your role in promoting a senior-friendly policy framework in the city of Vancouver. I think I'm sure we'll talk more about that, but it's real leadership and something that we need if we're going to deal with the real pressures that are coming at us from an aging population.
Fantastic. You're right. We should talk a little bit more about that later on, but let's go back a few years. You started out as a veterinarian and even taught animal health technology. What made you take the leap into politics?
Well, firstly, I actually started out as a radio journalist. I went to broadcasting school at Mount Royal College and worked in a couple of radio stations before ending up at Broadcast News, which was part of Canadian Press in Edmonton in 1980. Then went back to university after getting married and went into veterinary medicine, practiced for 20 years, including teaching at the Animal Health Technology program at the then University College of the Cariboo, which of course now is Thompson Rivers University. And, Mike, there are people that kind of have, they can be smartasses, or you could think of them as someone that just likes to hear their opinions. And so I always thought, if you're going to want to hear your opinions voiced, you better get involved. So I was always involved, whether it was, in high school, junior high school for that matter, on school council, and then in veterinary school on the student union, in veterinary medicine, involved in the BC Veterinary Medical Association, Canadian Veterinary Medical Association, World Small Animal Veterinary Association. So, people always said, you're going to be in real politics one day. And so when I moved to Kamloops in 1997, a couple of years later, there was a run for city council. And I thought, well, what the heck? I'll throw my hat in the ring. No one really knew who I was. But I tried pulling the old Dr. Terry Lake for city council, and that gives you instant credibility. It seems it's a good political trick. And I came 9th out of 36 candidates. And of course, the first 8 get elected. So I just missed it, but I got a bit of the bug. And 3 years later, because there were 3-year terms back then, decided, well, I'll try one more time, see what happens. And of course, I got on city council and really enjoyed it. Still teaching at TRU, still doing some veterinary medicine, but really enjoyed that sense of camaraderie with fellow councilors, even though we didn't always agree. Felt like you were doing something positive for your community. And then, of course, when the opportunity came to run for mayor, I took that on and thoroughly loved being mayor of this great city here in the interior from 2005 to 2008. So, you get in, you like it, and it comes with a lot of pressures and a lot of things that some people may consider negative. But I got to say that I thoroughly enjoyed my public life. I felt a sense of, that I was contributing. People were mostly kind to me, and I made a lot of friends and relationships that exist to this day.
That's Terry. I've known you for many years now, and I am funny, I never asked you about those early days, and I've forgotten about your broadcast experience, but I feel like in many ways, a lot of our paths overlapped, including running once and coming in close and not winning. Um, so when you were sort of heading into politics, did you ever imagine one day you'd become BC's Minister of Health?
No, I thought I'd be the premier, actually.
That
Uh,
makes
I when I got into provincial policy in 2009, there were two MLAs from Kamloops, Kevin Kruger and then me, and forming a cabinet is a tricky thing. You have to have regional representation, gender representation, ethnic representation, but you want to have a skill set that's represented at the table too. Kevin was a existing cabinet minister, and so I didn't make it onto cabinet for the first couple of years. And then when Christy became leader and she asked me to be environment minister, I thought I died and gone to heaven because this was why I ran provincially, was all about the environment and the progressive policies of the Gordon Campbell government at the time, the carbon tax, and just the approach to carbon policies, greenhouse gas policies, environment generally, and also, of course, I think, groundbreaking and progressive approach to First Nations relationships and reconciliation. So that was a dream job for me. And then after the 2013 election, Christy, called me in and said, you're not going to be environment minister anymore. I thought, damn, because I thought I'd continue on. And I thought, please don't make me health minister. Please don't make me health minister. And of course, she made me health minister. And, I've always loved medical things, physiology, anatomy, public health. These are things that I've always loved, but it's such a daunting task to be health minister. So, I never really imagined that I would, but I could not turn down the opportunity to take up that challenge. And 4 years, it was tough for sure, but I'm so glad that I had that opportunity. And of course, it has allowed me to do other things in my life following politics, including heading up this organization, which really depends on a intimate relationship with the Ministry of Health and those connected to the health system.
Just when I think about Kamloops politics and the fact for so many years they were seen as ultimately swing ridings when things were potentially swinging back and forth, NDP, BC Liberal, whatever, Socrat of the day. And your politics, from what you've already said, would swing Liberal, centrist. But today, it's hard to imagine, now that the BC Conservatives have swept across the province, in some ways, that some of these towns in the interior would have space for small L Liberal politics. I wanted to maybe what you think about that.
Yeah. Well, as you know, Mike, in British Columbia, you either are the NDP or you're not the NDP. If the not NDP vote is split, you get the NDP. And I, not to comment on the record of the NDP, but, people in the interior, generally in smaller communities and in the more rural communities, tend to be more right-leaning. So the BC Liberals were seen as the alternative to the NDP. And even though I'm a Liberal, and when you say a swing Liberal, I'm a Liberal. I mean, there's no question about my liberalness. And so people that supported a right of center or center-right party like the BC Liberals voted for me because the alternative was to vote for the NDP. And while there is good support for the NDP, and if we've been NDP up in late 90s, for instance, since that time it's been solidly center right voting tendency. And so lots of people, even though they were my friends and had great relationships on our politics, even though they voted for me, they had different views than I did on many things. And we were a big tent, right? But I had to be pragmatic in caucus, in dealing with my constituents. And, you go up the North Thompson Valley, the Barriers and Clearwaters of the world, they're very conservative. But I loved every single person that I dealt with up there. They taught me a lot about entrepreneurship, about independence, about the land, about ranching. And so, I think for so many people, politics gets in the way of relationships. And I try not to let that happen to me, although it's hard not to block it in every instance. Um, but, it came home to roost when I ran for the federal Liberals in 2019, because all those more conservative folks that supported me as a BC Liberal, very few of them supported me as a federal Liberal. Now, part of that was, Trudeau. Justin had fallen out of favor with a lot of people compared to 2015. And even though people may have liked me personally, they certainly did not like Justin, and they didn't like the federal Liberal Party in 2019. So it may be different this time around, with the surge of Mark Carney. People have been after me to run again federally. And I've told them that I need a dog more than I need to get back into politics. So that's my choice. But I do think the right person would have more of a chance today than they did in 2019 in the Kamloops, Thompson, Caribou region. But definitely that's the division we see in the legislature today, is the Conservatives representing the more rural, interior, northern ridings, and then the NDP mostly getting support in the city.
You hinted earlier that your experience, both with veterinary medicine and then as Minister of Health, helped you get to where you ultimately became the CEO of BC Care Providers. But was it a path that you kind of envisioned at some point? I know nobody can see that far in the future, and I know that I often see a lot of young people when they come through and they ask, how did you get? And I have a line that I use all the time, that I wouldn't wish my career path on my worst enemy. But the fact is that public life and just things come along that create different opportunities. I'm wondering if you, before you became the CEO of BC Care Providers, did you sort of see yourself as doing something like you are doing today?
It's hard to know. I never envisioned myself doing any one thing, Mike. I've always, if a door opens, I tend to walk through it. I'm very curious. People say I have a short attention span. Maybe that's more the truism. But, I never thought I'd work in the cannabis industry. I think I probably smoked cannabis 3 times in high school. That was it. So, here I was, vice president of corporate social responsibility for one of Canada's largest cannabis companies. And I thoroughly enjoyed that. And I used my knowledge of public health. I used my knowledge of medicine in that job. And today, when this opportunity came, and I wasn't looking for it, but it came looking for me, and I knew this organization. I knew the existential threat that an aging population has for our society. And I just thought it would be an enormous challenge, especially in the middle of COVID, to try to lead this organization, work with people like you, who I must say, and I came in September, and, from March on, you, for most of that time, were the interim CEO. You and your team and the team at Safecare BC did an absolutely amazing job dealing with a crisis that we knew nothing about. We didn't know if it was airborne. We didn't know if it was carried by droplets. We didn't know if masking helped. We had no PPE. You took on that challenge. You and the team did a remarkable job. And so, I learned a tremendous amount from you and others in the organization, and the folks at Safecare BC, as well as the health authorities and the ministry, of course. So it was a great opportunity, and I've just thoroughly enjoyed it. And I feel like it's such meaningful work, because, you're helping people that are the most vulnerable, people that need care, either in their home or in assisted living or long-term care or retirement living. And many families are struggling, really struggling, trying to find answers for their aging family, whether it's their mom and dad or family members, other family members. And to feel like you can help a little bit, either through your members that you support or directly by connecting them with the resources necessary, it's a tremendous feeling. I've just really, really enjoyed it.
Well, we'll talk a little bit more about the seniors care sector, a little bit out with to whet both of our mutual interest in the topic. But I'm going to stick to politics for a little bit. And as somebody who has served both at the municipal and provincial level. Um, how do how do you describe the biggest differences in terms of getting things done at each level?
Well, that's a good question. I think the consensus seems to be, and I saw this in my experience, that at the local level, you can do things faster. You can make things happen relatively quickly, especially if you have a council that works together and you've got a good vision for the city. You can work with your city administration to get things done relatively quickly. In the provincial government, that's more difficult to do, especially, you consider the housing file or the health file. It is actually, I used to like to say it's like turning an oil tanker around until I listened on a podcast and found those things can turn 180 in 5 minutes. So I don't use that expression anymore. So it is tremendously difficult to get things done. First of all, you've got so many competing interests. You go to the premier's office or cabinet and say, I really want to get this done. You're competing with every other ministry for priorities on the legislative calendar. And then you may have an idea. And my big idea that I never got done was to get rid of the gall darn fax machine in healthcare and, go to true electronic health records. And that was just so difficult to do for a number of different reasons. One of which was getting the legislation necessary to really have proper health records, electronic health records, and competing with every other ministry. So it takes a lot longer. So short story, yes, working at the local level, someone can phone up and say, hey, Terry, my street didn't get plowed today. You can phone up and say, hey, what's going on up in, the Dufferin neighborhood? How come that didn't get plowed? Or, that my road's got all these potholes. You can phone and say, hey, what's going on up there? And you can turn things around pretty fast, get things done pretty fast. Not so much in on the provincial, I'm sure, even less so at the federal level.
Yeah, I'm these days I'm putting always putting a word in for local government, for municipal government, because I'm sort of seeing in our example, and I won't go down this path too far, that again, that working relationship at the council level, being able to work effectively with a great professional civil service, you can work some miracles in that environment if you really decide on it. And it's not just about potholes anymore. You can be darn sure, right? I mean, you're dealing with health concerns, you're dealing with public safety, you're trying to figure out how to pay for infrastructure. You're just trying to forge relationships or try and foster important city building relationships within the community itself. So I would sort of say to anybody who's thinking about being in local government or is there now and kind of wondering what the path forward is for them, that's my view is use your imagination, but a lot of really exciting things can happen. A naive part of me would think that it's possible somehow in the provincial level as well, if you get the right dynamics, from the leader on down in terms of being able to move some big files forward. Because, again, it's a giant civil service. Things tend to move slowly, but if you can find the right leaders among the civil service, you can do, I think, some fantastic things as well. But I guess
You're right. That is the naive part of you.
Sorry, one can only hope and dream. So thinking back to your time as health minister, you played a significant role in responding at the time to the opioid crisis, which was really kind of emerging with some vigor towards the end of your term as health minister. Looking back, and this is not to judge individuals, but do you think BC is on the right track, or do you feel like there's areas where you may have lost ground since that time?
Yeah, when we first started noting the uptick in overdose deaths, that was around end of 2014, beginning of 2015, maybe. Historically, we had about 300 deaths in the province each year due to drug overdoses. And so Perry Kendall, who was the health minister or public health officer at the time, a great guy. Yeah, he and I had a great relationship, and he treated me like a colleague, which was refreshing, and I appreciated that. And I asked Dr. Kendall, I said, Perry, what's going on here? And he said, well, Minister, we had something similar in the 90s. It was a black heroin, I believe, that was causing a problem then. And it kind of, once that worked its way through the market, things changed and the sort of numbers went back to baseline. And then it just never went back to baseline, kept going up and up and up. And so all of a sudden we realized this is not the usual scenario. This wasn't just a different type of heroin. This was, of course, fentanyl, and then later carfentanil, and then later mixtures of others like benzodiazepines and other drugs, all kinds of different combinations of veterinary and human drugs mixed in together. So, of course, we wanted to just keep people alive until we could figure out what the heck was going on. We knew that fentanyl was coming in from China in very small doses. We worked with the federal government. There was a big effort at the border to pick up on the very small amounts of fentanyl that were coming in, because you could order it on the internet. And then, of course, it was getting mixed into everything, cut with everything here. And then, of course, the Mexican cartels got involved. And that's when it started to get really bad, because fentanyl precursors were being shipped to Mexico, packaged up, and then sent into Canada. And once that started happening, we just needed to keep people alive and try to come up with some strategies to deal with this. It was very frustrating for me. I remember going to Ottawa when BC was by far and away the only province that was really affected by the overdose crisis to any great extent. Starting to see upticks in Alberta, a little bit in Ontario, and going to Ottawa, and you had all these health experts from all across the country, and all they could talk about was overprescribing by physicians. And I tried to tell them, this isn't about prescription drugs. This is about a toxic street drug supply. And I really couldn't get traction with them on it. It was really weird. Anyway, fast forward a couple of years, everyone realized that's what the problem was. It may have been exacerbated by the prescribing practices of physicians after Purdue Pharma and other drug companies, marketed the heck out of opioids as if they were not addictive. So I remember one day, it was actually one night, staying at the Delta in Victoria, and it was cold in my room. And I woke up in the middle of the night. I'm a terrible sleeper anyway, but I was really cold. And, in Victoria, you don't get that cold in the middle of the night. But I started thinking about people living on the street, many of whom, have issues with substance use. And I just thought, my God, how horrible is it for people living outdoors that are dealing with this problem? And I had visited Sarah Blythe at the overdose prevention volunteer site in the downtown east side. And I realized that at least someone was doing something, and we should be at least doing what Sarah was doing. So I called the premier office the next day, talked to her advisors, and said, look, I'm going to tell the health authorities to open up overdose prevention sites across this province. If anyone has a problem with that in the premier's office, I need to know in the next hour. And I went back and they said, no, Christy's good. You do what you think you need to do. So I called all the health authority CEOs and the public health officers from each health authority, and I said, I want you to open overdose prevention sites as soon as possible. We've got to keep people alive until we figure this out. Now, the object of that wasn't to think that this was going to solve the problem. This was to buy some time, keep people alive so that we could figure out how we got people into recovery, how we attacked the toxic supply on the street. So it was never meant to be one, pillar of the four pillars that, we've come to understand. The object was always to add other pillars later. And so, I worked with people like Marshall Smith, who was a big into the, recovery community in British Columbia at the time, worked with the BC Centre for Substance Use, that Evan Wood, and, people that really knew addiction and knew about treating addiction. And I tried to put together a kind of a coalition of people that had all kinds of different approaches to this problem, a harm reduction approach coupled with a opioid substitution program approach coupled with the recovery approach. And you can imagine steering this through a caucus, that included some very conservative people was tricky. But, Christie supported me and the caucus generally supported me in doing this. And I thought we were making some progress. And even when I left in 2017, when I decided not to run again, we did see a bit of a dip. And then COVID came along and it just wiped out all the gains that we made. And I fear that we have over-relied on harm reduction rather than putting together more treatment options, more education, and in fact, more enforcement. I don't think that it's okay just to say that anyone should be able to use drugs anywhere they want. The impact on the public means that you lose the public's will to have compassion and to support those policies. People are very compassionate, very empathetic, but when they can't take their children downtown or to the park, they don't feel they belong in those spaces anymore. You alienate the public, and I think that's what happened. And I think that's what we saw in the election in the fall, was that the whole legalization and safe drug supply issue and the lack of enforcement, the lack of treatment options, people said, we've had enough. And even though they were compassionate about people who were suffering from mental health and substance use issues, they didn't feel we were on the right track. And I think that's why Premier Eby and the government have kind of reversed course and now have a more holistic approach, I think, to this problem.
Terry, when you started that story, I chortled for a moment just because I was trying to imagine you, and it was clearly you had support from the premier and the people around her. But I was just trying to imagine what the community, given the environment we're in today, what the communities how they would have responded. Oh, we're going to bring and put overdose prevention sites in your community or wherever that might be across the province. And I can imagine you heard about it. Like people would be, because of the fear factor, but it sounds to me that somehow there was at least some kind of embrace of it at that time.
Yeah, I mean, we declared, Dr. Kendall declared a public health emergency. Well, I think people understood that this was not, usual times. And so I think they embraced the approach because it was a wartime measure, if you like. It was a public health emergency. We were going to do something now, but we were going to supplement it with other things later. After 5-6 years of that, especially during COVID, without seeing the other parts of the strategy, people got compassion fatigue. And they saw the impact on their businesses, on their personal lives. And so they weren't as supportive of that approach anymore. But initially, I had very little pushback from businesses, from the public, from my conservative members of the caucus. But it shows that, you've got to have a stage 2 and a stage 3 to these kinds of strategies. You can't just rely on one thing, because if it's not working, people want you to switch course.
I wanted to shift gears a little bit, talk about your becoming CEO and moving to BC Care Providers in the midst of really the biggest crisis the sector had ever faced. But what you've just described now, dealing with the crisis of the opioid epidemic that was happening across the province, in some way may have sort of steeled you a little bit for this bigger and challenge that society was facing in 2020. You think that's a fair kind of understanding of what you were thinking going into that role?
I think so, Mike. When you're given a challenge, and all of us were challenged by something that we just didn't know. It was very similar to the opioid crisis. We didn't really know why it was happening at that particular time. With COVID, do you remember we were disinfecting our groceries? We had to line up outside of Home Depot, and we, looking back, we basically held people in long-term care, prisoners from
That's
their
right.
own families. We did it for all the right reasons, but looking back, I think we made some decisions that were probably detrimental to the lives of those that we serve, and so I think we learned a lot of lessons. We kept kids out of school, although BC, I think, was better than most jurisdictions in keeping kids out of school. Uh, we got them back relatively quickly. There was a lot of things we did because we just didn't know what we were facing. But yes, I think when you face crises like that, you kind of have a bit of a armamentarium at your disposal to know that, okay, just because you don't know everything doesn't mean you can't do something. And so you try different things, and you research as much as possible, advocate for what you think is the right thing to do. And you and I together, and along with others, worked with the Ministry of Health and with Dr. Henry and others to really put in place policies that we thought were the very best for those that were in care, whether it was long-term care, assisted living, home care, and really brought a lot of people together, and I think made the system stronger because we didn't worry about, oh, you're in the private sector, you're in the public sector. We just all knew what we wanted to see as an outcome. That was to make people safer, live longer, be less vulnerable, and to reunite families. And so I think it really brought the sector together a lot.
So you're now in your fifth year working in the senior care sector. And what do you wish that the public understood better about seniors care in this province?
Well, I'm a baby boomer, and when I was in grade 11, we could not build schools fast enough for all those teenagers, right? I mean, we were piled in classes in portables. We even went to school on shifts. So half the school went in the morning, half went in the afternoon, and we switched, halfway through the year. And so we all knew that, and people like me, that 16-year-old back in grade 10, when I got to be in my 60s, as I am now, that there was going to be a big need to deal with the issues of aging. Health problems, of course, increase with age. It doesn't mean that everyone that is in their 50s, 60s, 70s is ill or needs help, but many more do than when you're in your 30s and 40s. And so we all saw it coming, just like we saw climate change coming in the 1980s and 1990s. But it seemed like a problem far away. And that was the next government's problem, because that wasn't what the ballot question was going to be at the next election. And, the emergency room and the family doctor situation and, jobs and inflation, all these things were bigger problems than dealing with an aging population or climate change for that matter. But, you and I looked at that paper that the Royal Bank put out in 2020, and they determined that the two existential threats to Canadian society was, number one, climate change, number two, an aging population. So what I would like people to know, even though it's not in favor anymore, dealing with climate change, unfortunately, that's going to haunt us for a long time. But we have to deal with climate change, and we have to deal with an aging population. So I hope society understands that we still haven't hit the critical mass yet. I'm going to be 68, in a couple of months. And when I'm 78 and 88, that's when we're going to see a big, big problem with our healthcare system, because that's when people really start to need help.
Yeah, I'm starting to get getting some flashbacks to those conversations that we would have all the time with so many different groups, whether it be speaking to stakeholders in government or the media. But one of the things that I've really tried to do is bring what some people term an entrepreneurial mindset to the work I'm doing in local government, which means opening up opportunities for innovation. where are the opportunities for innovation when it comes to seniors care? You're working with a lot of different groups and companies and individuals and some very smart people. But when you think about it, how do we maybe use innovation of some kind to address the massive challenges that we're facing?
Yeah, a couple of things, Mike. First of all, it's not government's job to solve everyone's problems. I
Right.
think we need to understand that this problem is too big for any government to solve. We have to solve it as a society. Now, government can put in policies that make it easier. One thing we've been pushing for is a aging in the right place tax credit. They have this in Quebec, which has been dealing with an older population even longer than British Columbia has. And it allows people to use their money to offset, to use for the costs of, it might be for retirement living fees. It may be for people to come into your home to help you with laundry, with housekeeping, with yard work. It may be for home health to come in and help you with activities of daily living to supplement what the government is providing. And that way you've got kind of a customized, tailored program that the government doesn't have to design from the top down. It really is, what do I need as a person or as a family to help me age in the right place? And that tax credit system, I think, is way more flexible. So that's one thing. But I think we all have to look after ourselves more. We have to think about nutrition. We have to think about exercise. And, it's never too late to get into good, healthy habits. Eat less sugar, get into walking every day, get into socializing, reduce your drinking. All of these things will keep us healthier longer. Good sleep. That's a big thing that I've always struggled with, and I try so hard to correct. These are the things that we all can do. And I think we should all be talking about those all the time. And local governments, for instance, and this is what you're doing, Mike, you make your cities more age friendly. Now, we've been, spending a lot of time down in the North Shore. We've got, our own grandson, our only grandson down in North Vancouver. So we spend a lot of time down there. That Spirit Trail along the North Shore, that's a way that the North Shore communities have come together and created this wonderful area where you can walk or run from, Park and Tilford all the way to the end of Dunderave and back. And I see so many people along there, young and old, getting exercise. We've got to do that everywhere. Make our communities more walkable, more accessible. And that gets people in better health and reduces their reliance on the healthcare system. And the healthcare system itself, there's lots of innovations there. You and I were talking before we came on the air about artificial intelligence. I think we're never going to have enough doctors, nurse practitioners, others to deal with all the needs we're going to have. So let's optimize the people we have. And instead of paying doctors basically to reduce their hours and see fewer patients, which is what we're doing now by paying them more to see fewer people, we need to optimize their work by using artificial intelligence so that you can have chatbots connected to your electronic health records, your lab results, your imaging results that can diagnose your problem, send you for further tests before you get to an actual human. Then they can make sure they're coordinating your care and just making sure everyone's on, everything's on the right track. But we're never going to have enough people to look after all the needs. And so we need to use technology and not be afraid of using artificial intelligence. A Journal of the American Medical Association article recently showed that ChatGPT does a better job of diagnosing than a human physician does. Now, I've got nothing against doctors. We just are never going to have enough. So let's optimize them by using the technology that is available to us. Data, we're not using data properly. We have no data sharing. If I'm in an accident in the Lower Mainland and they want to see my medical records from Royal Enland Hospital here in Kamloops, they can't do it. Two different systems can't talk to each other. It's ridiculous. We got to figure this out.
You've been doing government advocacy. You were both working in government, but outside doing government advocacy for the last several years. You get to sit down with the premier for 20 minutes. We just talked about some really cool ideas there. What's the one piece of advice that you'd like to give in that moment?
Well, I think, helping the premier understand this challenge of an aging population, as I just sort of expounded on, would be one thing. Um, and I've had the opportunity to talk to the premier and talk about the drug crisis, for instance. Talk about what's happening elsewhere, like in California, where the state prison system is instituting a really great drug recovery program. And in fact, he's starting to do that here at the Surrey Pretrial Center, for instance. And I think, and I understand there's a small program here at the Kamloops Regional Correctional Center. Our provincial jail system should be the very best treatment program anywhere in North America. I mean, folks are there. We talk about mandatory treatment, and compassionate, you know, mandatory treatment. Well, they're there. They're there already, and many times because they've got mental health or drug addiction problems. Let's offer, and in some cases, order that they take treatment and provide them with the best available treatment. We have the PHSA that provides medical treatment in our provincial jail system. Let's make it the very best recovery system in all of North America. That would be the one thing, if I could get that done around the province, if the premier were to do that. I think, number one, we'd give people an opportunity to succeed when they come out of prison. You can imagine that revolving door that we keep hearing about. Well, it happens. We have the Provincial Correctional Center here in Kamloops, and I saw that as mayor, that a lot of people just came out and, often their girlfriends would come and move to Kamloops, and they would stay here and reoffend and get back on the revolving door. We've got to find a way to help them succeed when they exit the system. And I think having the very best recovery system is one part of that.
So, you're a Kamloops native. You raised a family in the city, and like many other jurisdictions, it has its own challenges that you're seeing, and including rising crime and homelessness, mental health challenges that are on display. What do you think is missing from the conversation right now when it comes to solutions in our small and mid-sized cities?
Well, we have the added problem here in Kamloops of a very poorly operating city council. Most of the councillors, I think, are not to blame for that. I think it's, we have a mayor that refuses to work with council, refuses to work with the administration, refuses even to go into his own office that they created for him so that he couldn't access other parts of the building because he was, making life difficult for the administration. So that's on top of all the challenges a small city like Kamloops of 100,000 people has. If you're a downtown business person, you feel like you're under attack all the time. You're seeing, tax policies that work against you on the federal side. You see, crime and disorder going on in the streets that make people not want to come downtown. You're competing with online shopping, and, all of the factors seem to be going against you. And so I think city governments need to really have empathy for the businesses that make downtowns in particular vital. I don't think you can have a real community without a downtown. I really don't. I think you need that center where people can congregate, where they celebrate on holidays, and they go down there on the weekends. We have a great farmers market here, and it's great to go down there on a Saturday. It'd be nice if people would spill over from the farmers market to all those shops, and many of them do. But many I know just go to the farmers market and go home because they don't want to run into what's happening on the street. So I think that's a real challenge, and local government can only do so much. And you need the provincial government, the health authorities, the BC Housing, to be all working together. And I do think there's real efforts. I know there are here. I mean, the biggest social housing provider is Ask Wellness, run by a very good friend of mine who I think does a heck of a job given the challenges, works really well with BC Housing. But this is a difficult population to work with in many instances. And that's why I think we need all four pillars approach to the problem, and to feel, for city councils to feel like they've got allies in the province, and that is the health authority and the government in Victoria working alongside them to make these cities work. I know Victoria, many parts of Victoria, same sort of problem along Pandosy, for instance. Sorry, that's in Kelowna. I'm forgetting Pandora Street in Victoria. It's the same sort of issue. I have a daughter who lives in Victoria, and at times she's told me she's scared to go out of her house, and that shouldn't happen. So we got to get on top of this problem. I know it's a North America-wide problem, but that's no reason to give up on it. But I do think that the progressive left-leaning policies, while well-meaning, have not garnered the results. And we've seen that in San Francisco and Los Angeles and Seattle and Portland, and we see it here in British Columbia. So that means we've got to try other things. And people hate to think that they're being cold-hearted or that they're stigmatizing people. But at the same time, it's not compassionate to think it's okay to see people lying in the street, defecating in their clothes, and not feel like there's a better way to manage this challenge.
So sounds to me that 10 years ago when you were running the health ministry, that to today, some of your thinking rightfully has evolved over that time in terms of how we address these challenges. Is that true?
Yes, I think they've evolved, but I always believed. I remember when the mayor of Vancouver, remind me of Philip's last name. Owen. He came to Kamloops and he spoke, and I went to hear him speak, and he talked about the 4 pillars. And I really bought into that. It made a lot of sense to me. I mean, I grew up in a military family, so I've always had a sense of order and discipline. So having, a police presence and having consequences to your actions made sense to me. Having compassion and harm reduction and helping people made sense to me. Educating people made sense to me. So all of these things just made sense. But I never ever thought that it was one part of that spectrum and not the other part. So while my thinking has evolved a little bit, it's evolved in that I think we've relied too much on on one or two of those pillars rather than all of those pillars. And I feel we've thrown the baby out with the bathwater in many ways. I still remember when I was mayor of Kamloops and I was in Vancouver, and I saw a young woman on the street. She might have been 15, 16. And I walked past her and I could tell from what I knew, she looked like she was hooked on meth. And I went up to her and first of all, I walked past her and then I just tugged it in my heart because I thought this could be my daughter. So I turned around and I asked her, where she was from and when she last talked to her parents. And I gave her a little bit of money that I had. And I wrote a column about that in the Kamloops Daily News. And, it almost, it makes me very emotional today thinking of young people on the street, and that's going to be their life from now on. We've got to do more to be able to take young people especially and get them on the right track sooner, because once you get into that environment, it's very, very difficult to find your way out. And I think in a very well-meaning way, we've in some ways enabled this to happen. And I know there'll be people who call themselves progressives who will admonish me for that, but it's just not okay. It's just not okay to take someone who's had a hard life and see them on the street at that age and not rescue them. We've got to rescue them.
It's a sentiment that I support, but I know that when we were working so hard before to try and I know that there's been work that's happened since I left care providers around recruitment and addressing some of the staffing challenges. Those challenges still exist, and they would definitely be just as profound in this space in terms of social services and helping people with addictions and through their health challenges like that. It must be that's the part that leaves me concerned.
Hey, you're right. And, one thing we learned, Mike, during COVID were how important those people who work on the front lines are, whether they work in care or they work, in services, uh, and retail. They didn't get to do what we're doing, work from our homes and be on Zoom. And I think we've undervalued that part of the workforce for too long. We've glorified tech, the professions that in finance and business and even trades and technology, and we've not valued the people who work with people. And so one thing this government has done, and I applaud them for it, is wage leveling for people who work on the front lines, care aides, so that, someone that was making maybe $17, $18 an hour now makes $25, $26 an hour. And that's, through the wage leveling policies of this government. So I think that has made a difference, and we've attracted more people into the care sector. Thank goodness. So the challenge of staffing is not as challenging as it was. But same in the social services, we need to value people who work at the front lines in nursing, in social work, so that they feel valued and they can make a good living while doing the work that is extremely difficult to do. And I don't know if I could do it. And I just, thank goodness that someone else is willing to do that.
And I totally agree with you that the wage leveling policy, which cost a lot of money, a lot of funding went into that, was, I think, a transformative policy that could be looked upon back then here in British Columbia during that COVID crisis. Your time at BC Care Providers is counting down, and I just kind of wondered what you thought the qualities you think a leader needs today, particularly in the not-for-profit sector, to be successful.
Well, you have to be patient. Number one, things don't happen overnight, as we talked about with government policy. You have to forge relationships, educate people, advocate for the things you believe should happen. You have to work with your team, and one of the best parts of my job is working with a relatively small group of people on my staff that are relatively young, that have built up their skills and just have, perform at such a high level, and allowed us as an organization to perform at a high level, but also work with a board of directors that, come from different worlds, and whether it's family run organizations or big corporations, they have demonstrated leadership to me. So I think any leader should look around for role models. You think, well, if I'm working with people that are all younger than me, what can I learn? Well, you can learn a lot. And I always look to the people I work with, whether it's the board or members in our association or my staff, and see what they're doing that works that I could incorporate. So I think I've actually better at that now than I was when I was younger. I wish I'd done more of that when I was younger. So I think that's a quality that a leader needs, is to know that they don't have all the answers, and that they can learn a lot from others, and they can emulate behaviors that they see as positive.
So with that sort of thinking in mind, you've been in the trenches in government and politics, business and advocacy. What's one sort of leadership lesson that stuck with you through all that time?
I think you've got to be humble enough to know that you can learn from others. That's a leadership lesson that I think sticks with me the most. I'm very comfortable with my knowledge base and my ability to learn. I'm quite proud of the fact that I can consume large amounts of information and understand it and apply it. But I've learned that I can be also humble enough to know that I don't have all the answers, and that other people can provide those nuggets for me. So I think leadership, as I said, is about being open-minded, but firm, and not being afraid to make decisions. Although, you've got to, this sort of thinking fast and thinking slow kind of mentality, the old Danny Kahneman book. It's some things you need to make a quick decision on. And you have to understand, I think, when that's the right thing to do and when you need to be more thoughtful and let things progress a little more before you land on a decision. Some things need to evolve. They need to be socialized. You need to get people in the right place before you get to that decision point. Other things, you're just wasting your time. Sometimes if you just continue debating and debating, you just got to make a decision and move on. So it's not always clear when that, the sort of division between those two types of decision making and types of thinking. But I think good leaders learn how to know when to make a decision quickly and when to let something evolve and develop and incubate a little bit more.
Terry, thanks very much. So what is the next phase for you? What are you thinking about doing? And I use the word retirement very loosely because it's kind of a foreign concept, I think, for our generation. We get our hands mixed in with a lot of different files, and once you become a strong advocate for a community, it's hard to shake that. But then again, there is a time to pull back and spend time with your lovely partner and your family members and grandkids and all the rest of it. So,
yeah,
what's the next phase look like to you, do you think?
Well, I sit on two boards here in Kamloops. One's the Steps Community Health Center, and it's a true community health center with a team-based approach to primary care. Just got on that board, looking forward to learning more and getting more involved. And for the last few years, I've been a board member of the Big Little Science Center, which has been around for 25 years here in Kamloops. And, science is a passion of mine, and I want to be able to turn kids on to science because, we're kind of going through an anti-science period, when you think of who's leading the Department of Health and Human Services in the United States and other things that are going on. We more than ever need to understand the role of science and how it's made our lives better. But I'm going to take some of my own advice too. I'm going to get a dog and I'm going to learn how to sleep better. I'm going to continue to increase my exercise and nutrition and do a little bit of traveling, enjoy my family, enjoy my friends, go to the Red Collar and have a beer with the guys on a regular basis, but not too often. And and enjoy. I hope I've got 20 really good years ahead of me. And so I'm looking forward to them.
Fantastic. Thanks very much, Terry. I really appreciated this conversation that we may have had in bits and pieces in the past when we worked together, but this was really enjoyable for me. So that's a wrap on today's episode of Vancouver Overcast. A huge thank you to Terry Lake for joining me and sharing his insights from a lifetime in public service, advocacy, and leadership. And if you enjoyed this conversation, make sure to subscribe to Vancouver Overcast with Mike Klassen on Spotify, Apple Podcasts, and YouTube at Overcast YVR. And don't forget to follow us on Instagram, Facebook, and X at Overcast YVR to stay updated on upcoming episodes and behind-the-scenes content. Thanks for listening, following, and sharing, and we really appreciate your support. And we'll see you next time. Thanks very much.